going back where it all got started and going through the offices and progression. I'm excited to be here right in front of our very first office, 1426 Walnut Street, in the center of Philadelphia. 50 years ago, and it looks remarkably the same. The building that we had has been torn down, and now it's a cheesecake factory. But I rented a little office right behind me that was the Bayada's first office, 2 little small rooms. And I had this idea that I was going to take home health care across the country. Since it was a startup, I did every role. The good news is I learned about what works and what doesn't work. It was very important to me that the clients get great care. Our motto is the clients come first. That was going to be the secret to our success. Our reputation and our future depended on it. But then my first goal was to get a case a day. And when we did, we outgrew the office. In a year, we had to move down the street to 1601 Walnut Street, where office number 2 was a year later. 1601 Walnut Street, the Medical Arts Building, that's nostalgic for me to be here. This building was all little doctor's offices and dentist's offices and medical type offices. Home health care fit right in. We were only here a year. Because at the end of the year, we applied for the Philadelphia Corporation for Aging contract, PCA, and got it. We got it right when David was born, and it doubled the size of the business. We had to put ads in the paper like crazy. We were interviewing nonstop to get enough aides to fulfill the contract. This particular office has I think a warm spot in my heart, because this is where I finally felt we made it. And next, we're going to go to 1315 Walnut Street, where we had to move to accommodate the larger business and having to hire more people in the office. Here we are at 1315 Walnut Street. This is our 3rd office, and this is where the company's growth really started to take off. This is where we got our first computer. We started to really grow and develop. I worked here for 7 years, but the last few years I was completely overwhelmed with managing the caseloads, managing all the service delivery, and handling all the back office and support services. So I had the idea, I'll move my office. So I moved to New Jersey, near where I lived, so I could have a work-life balance and concentrate on opening new offices and growing and expanding. Next, we're going to go to 290 Chester Avenue in Morristown, New Jersey, where I was there for 22 years. Let's go there now. This is 290 Chester Avenue, where I spent years. We had just become Bayada nurses before I arrived in 1983. We moved here in '84 from RN Home Health Care. And then in 2012, while we were here, because we were providing a wider range of services, we became Bayada Home Health Care, as we are today. So it was really taking it from a small little group of offices and expanding it to more and more locations and more practices. Also was developed here was the Bayada Way. It wasn't written down. Between our focus meetings and our retreats and our surveys, we really consolidated and clarified what we stood for, and it came out in the document called the Bayada Way. And we said, now we want to introduce it to everybody. We purchased a 38-foot motorhome, an RV, and put Bayada all over the side of it. And I proceeded to visit every office in the country to introduce the Bayada Way. So I left this building in 2016, and I always wanted to be up on Main Street. The building I admired for years, 1 West Main Street. And we're going to go up there and look at that building right now. This is 1 West Main Street, Morristown, New Jersey, which is my office now. We moved here in 2016. And this is where we support the mission and values in the Bayada Way for the company. And also it's an old house. We restored it like we restore people's lives. And also all our nurses do their work in private homes. What better place to support the Bayada Way than a converted home? Actually, my role and the nature of the company changed the most here in the last 5 years. I gave up the company. I didn't own it anymore. I turned it to a nonprofit, so it's really owned by the public. The other is on my 70th birthday, I stepped down from being the president. David Bayada became the president, and I became the chairman. I felt David had worked hard, he was capable, and his heart was in the right place, and he would do a good job. I felt it was necessary to do, and I'm really happy I did it. I think I've adapted to the role change. The good news is I'm working with a lot of great people who internalize the Bayada Way themselves and want to move the company forward. Coming here was kind of a capstone of the journey I was on, and the realization, wow, what we're doing has grown, it's larger, people know about it, and it's important. And it's important we keep the same standards as we move forward and help more people.